Reports of several explosions just before 9 o'clock this morning at the Barton Solvent Company in Valley Center. Authorities have evacuated a number of homes and businesses within a 2-mile radius of the plant. Area residents have been told to go to the Valley Center Public Safety Building, the local high school, or the Kansas Coliseum.
Environmental health specialists help protect the public and responders from the conditions within a disaster that threaten human health.
Well, during a disaster, both the responders and the public are exposed to all kinds of vectors and contaminated water, dusty air, chemicals, all kinds of media that are now mixed up and are contaminated, and they have the probability of causing ill health effects.
And the role of the environmental health specialist is to assess these factors and design, prioritize, and implement an appropriate response. Environmental health is a subgroup of public health. In more populated areas, it could be a standalone agency. In rural counties, the environmental health specialist, or public health sanitarian as it's also called, might wear more than one hat and be part of the public health department. In a disaster, there can be many types of environmental hazards. A contaminated food supply, polluted water, chemicals, dust or other airborne contaminants, hazardous household waste, mold, trash, and many other undesirable media.
Environmental folks tell us what we can and can't landfill, burn, get rid of, whatever. They help us set up monitoring our air, transporting things and all the dust and everything afterwards. You don't know for sure what all is in the rubble. But they're going to help you how to determine that. They're going to monitor the air and make sure you don't have particulate matter that you don't want out there. Do we need to spray the roads today and keep the dust down? Whatever. All those things are things that none of us know how to do, but this is their world.
Vectors are of particular concern. Things such as mosquitoes, bugs, rats, and mice, which can quickly spread disease.
Well, following disasters, when we stir up a community, a lot of times the vectors, they get displaced and they start moving around, and whether it's feral cats or it could be cockroaches or other types, if it was a flood event, we could have mosquitoes. And somebody has to come in and monitor the environmental conditions in the community to protect these folks from impending danger that is a result of the initial disaster.
Environmental health specialists are not first responders. They respond to an incident strictly at the request of the county health officer.
Well, the first thing we do is, in a disaster, is we come in and help assess what the hazards or the exposures are. We may not have all of them, so we assist with the assessment. We help identify what those hazards or risks are. Then we participate in the planning process of how we mitigate those or how we resolve those hazards.
The first area of concern is often food safety.
Without electricity and without refrigeration, the first thing that we worry about is food. Food that was in the disaster that may not be safe anymore. Or it may be food that was brought in. Has it been prepared properly? Is it stored correctly? So safe food is important for both responders and the public.
The next area to focus on is water. A reliable source of safe water is critical for disaster victims and responders alike.
It may be drinking water. If the public treatment works is up and running, great. If it's not, then people start hauling in water in containers, or they go to people that have wells, and we need to make sure that the water that comes out of on-site water wells or in storage tanks is safe and potable to drink.
Air quality is of the utmost importance for everyone close to and even far from an event. Chemical and biological events have their own unique air quality issues, but even tornadoes pose airborne hazards.
Dusty environments following a disaster. And I'm thinking of a disaster like a tornado, where you have a lot of damage in buildings, houses, and streets. So, but if it's a different type of a disaster, such as a biological event or a weather event, we may not have the dust environment, but that would deal with the air quality in a home or in a building.
Wherever people gather in a disaster, be it in shelters, staging areas, or responder camps, proper sanitation is vital. Environmental health specialists monitor and inspect these areas to ensure that everything from showers to toilets to hand washing facilities are safe and working properly.
Red Cross comes in and sets up shelters. Maybe it's Salvation Army. We would work with them to make sure that those shelters are safe for the inhabitants that take up residency in a shelter, with the food, the water. They have trash needs, they have sanitation needs, they have to have bathing facilities.
Hazardous household waste poses special problems in a disaster. Bathroom and kitchen cleaning products and garage chemicals such as fertilizer and petroleum products simply can't be taken to the landfill. So environmental health specialists work closely with the public to help them dispose of these items properly.
They provided resources to us in Greensburg that went out, gathered hazardous materials, got collection points, made sure they were properly disposed of, in some situations actually even monitored leaking containers of hazardous materials to make sure that nobody got near it, that nothing untoward happened, and that it got cleaned up.
Almost 1/5 of Kansans have their own on-site water wells and septic tanks and do not have access to municipal services.
Folks that are on public water, public wastewater, KDHE is going to assist the cities with rehabilitating those systems. But there's a large group of folks that live in small communities outside of the main hubs, and they have on-site systems. And the public health sanitarian or registered environmental health specialist are the folks that are best trained to help them with their problems.
In any disaster, the one thing people want more than anything else is to return to their homes and reestablish their lives. Everything the environmental health specialists do helps move people closer to that goal.
They help them identify the hazards in their home, whether it's mold or bugs or contaminated walls, carpet, or they help them with their drinking water from a private water well. They help them with their on-site wastewater disposal, their household hazardous chemicals. They help them make their homes safe again.
To learn more about environmental health specialists and their response capabilities in a disaster, please refer to the resources that are provided with this video.